Piero Oliaro, scientist and working at WHO TDR. We've worked together for 15 years. I'm delighted you're able to come here today and talk with us.
Thank you, Paul.
Piero, recently a Cochrane review of rapid diagnostic tests in malaria was published. It included over 74 studies. It's a massive undertaking. Would you like to comment on how this review fits into the landscape of policy in relation to malaria globally?
Well, this is an important review. It's important because the WHO now recommends that before an anti-malaria treatment is given, a diagnosis of malaria is made, which means diagnosing, verifying the presence of the malaria parasites or their products. And this sounds easy, but it's not in the conditions of use, because the standard test is microscopy. You need a microscope and a trained technician, which are not always available. In the past few years, a number of rapid tests, which is called rapid diagnostic tests, RDTs, been made available, become available. A whole variety, array of different tests being tried. And the problem is to know whether they work, which one works, and which one does not work. So a number of studies have been done, and what we've done is to review the literature, analyze the data, and compare the different tests with the reference test microscopy and between each other. And the results are that they appear to be working satisfactorily, and therefore they can replace microscopy when they are needed. So this supports indeed the WHO recommendation and means that anti-malaria drugs can be used also more efficiently. Now, decisions as to which test to be used in which country has to be made locally. We've seen some degree of differences between the tests, how they perform, but there are no major differences.
Piero, we've been working together for 15 years on a variety of systematic reviews, both Cochrane and other systematic reviews. Can you describe any landmark reviews that have been useful to you in your job and the organisation in determining policy?
Well, going back to the mid-90s when we started that, I believe the first groundbreaking thing that we did was this first review with amlodipine, an anti-malaria drug, which had been removed from the list of anti-malaria drugs. And the systematic review we did for the first time was the first time the WHO used the results of a systematic review and a meta-analysis to inform a decision as to whether a drug should be on or not the list of anti-malarials. And in this case, the drug was then brought back into the list of anti-malaria drugs. So that was the first time, I'd say. And then a number of other examples followed. Again, in the area of anti-malaria drug treatment, we for instance, we did a meta-analysis, including, in this case, individual patient data of different trials of artemisinin-based combinations. A series of trials have been done over a number of years, and this meta-analysis also informed one of the most important decisions the WHO made, which was to switch from monotherapies, so single drug, to combination treatments. And then more recently, we also did an update of the overview of different types of anti-malarial artemisinin combination treatments to inform this latest update of the WHO malaria treatment guidelines. So these are three examples. Of course, there are other examples in other types of interventions against malaria, including bed nets, including insecticides, including specific interventions in special age groups or specific populations at risk.
I wonder if you might comment on whether the organisation, the World Health Organization, which is responsible for global guidelines, whether it's changed in its relation to the use of systematic reviews to inform decision making?
Oh, definitely. Definitely. Things have changed in the recent past, but they've changed significantly. Now, WHO is definitely adopting systematic reviews in order to generate guidelines. And there is a whole structure now that is set in place as to how the guidelines are generated, all the requirements, what are the pieces of information that are needed. Of course, systematic reviews rank high in terms of evidence that is required. And the entire organization is moving away from expert opinion and has moved definitely into guidelines that are informed by evidence. And like I said, systematic reviews are an essential element of that. Of course, other components are considered when recommendations are made, because policy recommendations are complex to make and must take into account a variety of other elements and factors. But there's another use of, above and beyond the policy, there's another use of systematic reviews which is often underestimated, but it's very important. And it is when systematic reviews find very little, and therefore no recommendation can be made in terms of policy. But this is a very important indication to inform research decisions and how to focus and where to focus research in the very areas where evidence is not available.
Piero, delighted you could come and speak to us today, and we look forward to working with you and your organisation over the coming years. Thank you.
Thank you, Paul. Pleasure. Cheers.